down, so it's a good time to pause. There we go. Okay. Still not the most advanced show around. So, got to use all sorts of tricks. Like right now, I have my mic at about eyebrow level on a headset because I otherwise am trying to drink my mic when I drink my coffee and kind of gets in the way of my smoking and drinking coffee, which is kind of something I'm probably not going to stop anytime soon. So, there goes that. So, what's going on? Well, as always, healthcare. And I don't know if my last show, because I record and re-record. I'm not much at editing yet. This is a very simple program I use to just kind of, get my thoughts out there. And although I'm working on much better technology, it's a work in progress, let's say. And I am kind of diminished brain-wise, let's say. So I am working on my Voice of Reason show and the things around it and the research and all that stuff. But I don't want people to forget about me. I'll get really sad. So I like to put up shows at least every couple of days. I know I missed yesterday, and that just hurts. I don't like doing that. I like to have something up every day. It's just, to me it feels like it's beginnings of my career in this, whatever that kind of career can turn into. And I feel like I missed work, like I called out sick. If I don't, I did actually record something last night, but like I said, I record and I get rid of, I record and I get rid of. Kind of like when I used to write a lot, I could have filled CDs with all the stuff I wrote, but then I'd kind of erase all of it. Not good enough. I turn into Godzilla and, start spraying fire out of my mouth and throwing things around the house and stepping on, paper models of skyscrapers. So it's kind of my MO. I've always kind of done that. But now for something completely different. Healthcare. I think there are a lot of places, I'm lucky to be in one of them, that have these kind of county programs, usually connected to a hospital, that are sliding scale, where you can get physical and mental health treatment, usually for free. I mean, they do kind of ask for a bunch of paperwork, but that's just like filling out an application. In the past, I don't think I would have had any trouble. Now I'm kind of like looking at this application thing and like it's written in Swahili. It's just very difficult for me. And hopefully, once I get through that process, I'll get some sort of treatment. Maybe there's like a modafinil in my future. I know that some of the like smart supplements have helped me a little bit. So we'll see. I think there's an upward spiral once you start getting the kind of healthcare you need in order to function. And once you get that, you become more functional. Once you're more functional, you can do more for yourself, and upward and upward and upward. So I'm hoping to create that kind of situation for myself. And I hope that people out there who may be in these kind of counties really look into these county programs that can help them. Like I said, they're basically free health care if you're really poor, right? And as you're maybe making a little bit more money, they're on a sliding scale. I don't think that there's that it just jumps up with, oh, you make $5,000 a year. Oh, okay, we want all of that. It's not one of those things. They're really trying to help people. And I think that's kind of an American thing to do, teach a man to fish rather than giving him a fish, getting them the health care they need to take care of themselves. That's always the concept I've seen, the safety net, the helping hand, either through the government or through charity or the mixture of the two, private and public. Like this is a program that's related to Memorial Hospital, which is a network down here in Broward. There's all sorts of things that are available, and I hope people, know about it. I hope that they can, when they need it, have the information to take advantage of it. I can't sit here and tell you like the numbers for all of the stuff all across the country, but I definitely encourage you to whip out the smartphone, which is pretty much ubiquitous, even if you have to borrow your friends, and look up where these things are. County healthcare services, I'd start out Googling. And you're going to find pretty much every county has something. You may have to, maybe you have to go a county over to like the state healthcare services, depending on the state, depending on the population, a really low population area. Maybe they have a group of counties, and then they have some services within that group. So you might have to, hop over a town. But remember that a lot of these places, they might be able to support transportation, provide transportation, or at least some sort of transportation support. Remember in New York City, they just gave everybody a Metro card that was good for 2 rides, so they could, every time they showed up, they got another Metro card. That would be good for getting them to the hospital and getting them back. So it's a pretty good deal, We're not that bad off, obviously, compared to a lot of third world countries, or not even third world. We're doing pretty damn good. We've had a sense of charity in this country for a very long time. I know people get down on Christianity, but it's those Judeo-Christian values that have pushed us in that direction where other countries haven't. And while we had this kind of pushback from the really fringe Republicans, I think it's important not to conflate, because a lot of people in the conservative camp are there for religious reasons, and usually it's abortion or something like that, not I don't want to give health care to people. There are very few that I've met. I've met some, so they do exist, but there are very few like these like far right, I don't want anyone to get anything from me kind of Republicans. And they usually have to be either very wealthy to even have that mentality, where they see no need for ever having a safety net, because they'll never need it and they know it. Then there's the rest. Whether it's Republican or Democrat. See, Democrats are more into, I'd rather pay higher taxes, and then have things kind of codified through the government. A lot of Republicans, especially the religious right, let's call them, whatever they feel about bathrooms and all that stuff, they give very heavily to charity as a group. In many ways, it's codified. A lot of them have something called tithing, where they give, I think, 10% to their church to provide services for people. That's the assumption, to help people, to kind of provide a safety net through that kind of community apparatus. That's a good word for it. So we're really kind of going to the same summit. It's just a different path. And I was actually in favor of these kind of, under the Bush II, Bush Jr., when he started talking about these initiatives, like faith-based initiatives, I was like, well, that kind of works. That could work. I could see how that could work. I'm not saying necessarily it would work out perfectly every time, but I could see how that could work. It's actually kind of a natural mix. These kind of religious organizations that are trying to do good, and of course not necessarily trying to convert anybody. I think in a lot of religious sects, it would actually be kind of a bad thing to kind of, well, we'll give you some rice if you become a Catholic. It's viewed by a lot of at least religious people. I don't know about the churches, or all the churches. You're really not supposed to recruit from the poor as like a price to pay for charity. How much people follow that, I don't know. That's why I think we need the government services, and they need to kind of, yeah, we'll help you do this, but you got to make sure that you're not just using it as a recruiting tool to kind of force people into a religion they may not be interested in at all. So, there are some questions with this, some big questions, separation of church and state. But I think a lot of those things can be worked out. It seems like kind of a natural alliance. But like I said, there are some details that have to be worked out. Of course, the big story in healthcare is, I guess it's being called quasi-Trump care. Right now, we're at a point where we just have kind of a framework of tax equalization through tax credits and repealing of a lot of the Obama mandates, or some of them. A lot of them were kept, actually. And also now HHS Secretary Price is going to have a bunch of leeway in order to kind of do what he can do on his end, almost like the president with executive orders. So we'll see what happens with that. And it's something to keep an eye on, but I'm cautiously optimistic. Remember, I'm not sure when the San Bernardino thing happened down here in Florida, but right after that, the Senate and the House voted to expand mental health care and funding for it. I think that was a very, very good idea. And also, mental health care isn't something you can get from insurance. Or at least if you do, it's in a very limited way for a limited time. If you have chronic disorders that you have to get medication for every month, that maybe you need to have like a 5-year therapy stint because of complex PTSD, which isn't even recognized yet, although some people try to get it into the DSM-5. It's something that it's almost always going to have to go down to the public supporting. And we used to, very heavily. We put a lot of money into studying people and putting them in hospitals. And I think you could just walk into a hospital and say, I have this and that problem. I need help. And there was no, oh, you need insurance, blah, blah, blah. It was just, they took you, right? But we had problems back then with parents being able to put their children in. My child is defiant. And then they could just kind of throw their children into a mental asylum. So there were problems. And if we go back to that system, we have to have some sort of logical solutions to those problems. Right now, you have to basically put yourself in, I think. And even if you say you're like a danger to yourself and others, they could determine that you're not. So you can't put yourself into a mental hospital. It's just not that much of an option these days unless you're seriously mentally ill. And then I think you could check yourself in. But if someone's really seriously mentally ill, isn't one of the signs of crazy not knowing you're crazy? So a paranoid schizophrenic is going to end up on the street. All right? Unless they're an absolute danger, running around with swords and, stabbing old ladies. I don't see what other proof could be given to codify that. Unless they're determined to be criminally insane, and then they go into, a criminal asylum. A lot of these other hospitals were closed down, or they were kind of wrapped into some sort of community hospital where that only really does outpatient. They don't do too much inpatient. We don't have a very good system. And if you look at the history, you can tell why. people going into mental health care, sometimes they need to be kept. Sometimes they were kind of a danger. But there were so many stories of abuse, of where, maybe the doctor was molesting, a couple of the patients, and they didn't want to let them out because even though they were quote unquote cured, or they were responding well to whatever medication, it was like a warden. They wanted to, if they were doing something nefarious, they wanted to keep those patients in, maybe keep them in for life so that they could never tell everybody what happened. It got ugly. I don't know how prevalent these things were, or if it's just these kind of like, almost like stories of corruption in the government where it gets blown up. And then people, want to change all sorts of rules when they really just needed to obey the law. That's already there. So it's a lot of questions with this. And with BL Babbles, I'm sure you've gotten by now that it's kind of where I ask questions aloud to myself and to everybody else, and hopefully get some input in preparation for kind of my almost more studious educational show, Voice of Reason. I mean, I have a lot of questions about this. It's stuff I got to research. Like, what was so bad about the system in the 80s that we kind of started closing down the hospitals? We started throwing people out on the street who were mentally ill. Like, what happened? It's something that has to be looked into, because it looks like we're just going to keep repeating and repeating and repeating it. And if there's enough shootings, and there'll be, suddenly there'll be enough money to take care of people mental health wise. But I would hope we don't need that. I would hope that those things don't happen in general. Let's not encourage them to happen. I mean, there's going to be a certain amount of people just losing it. That's just, a society, right? I mean, you're going to have that all over Western society. Is the answer no guns? Okay, then how do we defend ourselves? Well, we need to. How do we defend ourselves from people with guns? Because they're criminals. They don't care about the law. A lot of questions. So, healthcare. Looks like I'll be getting at least very inexpensive healthcare, if not nothing out of pocket, except for, all my taxes. But it's a bit more hopeful. I just wish that when I applied for Medicaid the first second I got down here, because I had it in New York. Not that I was really very fond of it in New York. I actually thought down here might be better. I think it is. If you're on Medicaid, yeah, it is actually a lot better down here, from what I can tell. But I got rejected, and I wonder if it's because there are these programs out there and they just didn't bother to tell me. I kept trying to find out about these programs, and it was through word of mouth in my area, where luckily a neighbor knew exactly where this clinic was. And I was able to get down there and get an application. You would think that as part of it, they would say, listen, you don't need this, but here's this, and this might help you a lot. And here's the contact information, here's the address. It seems kind of unorganized or disorganized. And I would hope people listening to this realize that there are these like free healthcare services out there. And if you're in the city, it's going to suck. It's going to be horrible. There's going to be way too many people trying to pull out of the coffers. They're going to try to get more money out of you because they just don't have enough money to serve the people that they're dealing with. It's going to be crowded. It's going to be a little scary. It's usually in the shittiest part of whatever city you're in. I'm pretty lucky here in Broward. I'm sure there's similar counties that have like a decent tax base, but don't have this huge um, amount of people trying to, take free health services. And honestly, immigration, this is one of the areas where immigration does become a problem. Immigration is usually concentrated in the cities, and then you have more people who are trying to get these services, and you have to hire translators. You have to, for like 8 languages. In New York City, it's like every sign in the hospitals was in at least 3 or 4 languages, if not more. It's a huge drain. It's a huge drain on resources. I remember going to college and finding out that there were people who had just, they would get out of state tuition, but then the state would pay for it, even though they weren't legal. What? Okay. I must be misunderstanding something about that, right? So they said, let's give them in-state tuition, and a lot of people flipped out. Meanwhile, actually, it would just mean that they're paying less, so that the taxpayers are paying less. It was just some weird system that didn't make much sense. And you can't have these places like Miami, Los Angeles, places that don't have the New York Stock Exchange. See, New York City, they say that if New York City got all the money back, and this is a lefty friend telling me this, so I don't know how much I trust it. If New York City got all the money back from the New York Stock Exchange, from the taxes on that, they'd be able to fund the entirety of the federal government, including NASA, like some craziness like that. Like we'd have our own space program. So if you're talking about people just coming into the country, I could understand New York City being able to afford a very large immigrant population, and it's appropriate. That's where the Statue of Liberty is, et cetera, et cetera. But a lot of other areas of the country, they just don't have the tax base. They don't have the amount coming in to put out that kind of cash. They talk, they argue about like a quarter-cent rise in like sales taxes and stuff. They have like all sorts of county meetings about stuff like that. But when they do provide services, they tend to be a lot better. They tend to be, pretty decent doctors. They don't just take, because they need 40 doctors, they'll take anybody. They only need 5, so they get to choose from the applicants. Again, one of my little theories. So what do you do in the big cities? Well, New York City can kind of afford it. Most other places can't. I don't think anyone could afford to be a sanctuary city. But let's get off immigration. Let's just say simply that it can be a big drain. It can be a huge drain. Because you have people taking services that haven't paid in yet. And there's only so much you could front in that situation. So, you're using taxes, and you primarily want to use those taxes for the people who are paying them first. And then there becomes a what's left over type of thing. And nobody wants anyone, I'm a liberal, I don't want people like starving or dying in the streets of things that could have easily been fixed with some sort of $10 a month pill. I'm not going there. I'm not talking about stuff like that. I'm just saying that it's something we have to look at with our immigration policy, so that we can be more effective at taking care of ourselves. And that will make us better at taking care of others, right? So, Obamacare is pretty much boiled down to a few mandates that it looks like are going to be kept. The 26 on your parents' insurance. Now, not exactly the whole pre-existing condition thing. It looks like they're going to do what's been a big idea from pretty much everyone around the spectrum for a long time, which is take the really expensive people out of the pool. You want to be paying for like average medical care, not for, obscenely high medical care. And I'll admit, I'm one of those more expensive people. Mental health, arthritis, degenerative disc disease. Like, I'm one of those people that's going to cost more. And I don't want to burden other people. But I don't have any money, so how do I do that? Or I don't have enough money. Well, the thing you do is you directly subsidize those people to keep them out of the pool, and therefore it doesn't drive up the costs for everybody on the other end when they're actually paying for health care, right? It doesn't drive up the cost for the employers or the employees. So it's kind of, okay, what do we need to do that? Okay, we need to directly subsidize. Okay. Now that, of course, you're going to have Social Security disability. Those people are really kind of taking out of their own coffers in a lot of ways. So it's that's really not what we're talking about. We're talking about people who can't get disability or still in the process. What do you do for them, especially if they're chronically ill? That's what we're talking about this kind of like direct subsidy, directly subsidizing them. And we'll see how they work that out. It's definitely going to have a positive, and then it's going to lower healthcare costs for other people. So it's a better solution than just like a blanket legal mandate that doesn't consider the ramifications of the legal mandate and has, 500 pages of, ridiculous weirdness going on. See, people want to help. We're a charitable nation in general. On the left, we want to do it through government. On the right, we want to do it through charity. But there are two paths to the same summit. We want people to be taken care of to a certain extent so they can get on their feet, deal with the medical issues they have, and, be a productive member of society as far as they can. We want to enable people. We want to give people access, right? And some people we want to directly subsidize. So far making sense. It's not the kind of crazy Republican, let's destroy Medicare and Medicaid type of thing. It's actually a more astute version of that, one that works out without taking health care away from a bunch of people because the price is so high that they can't afford it now. There's a lot of other things to reduce costs that are going to be kind of rolled out in stage 3. Hopefully a good bit of that also in stage 2. We'll see what Secretary Price can do. But right now, we're kind of in the same boat as we were in 2008. Things weren't working and we had to do something. Back then, it was, caps on care. There were, you could be rejected for a pre-existing condition. So there were, just like with the whole asylum system, there was horrors, right? There were bad things happening. We just didn't solve them so well. We saw what politicians and lawyers can do, but not what healthcare professionals can do. We just broke a system that was working for other people in order to make it kind of, a square peg fit into a circle hole. And it's not something you can do. And I hope you learned that lesson. I mean, Obamacare, I think a lot of people had the right idea as far as, of course, a lot of them wanted the public option. They thought that would be a good idea. Maybe it would have worked out a little bit better with that, but still, you can't regulate and regulate and regulate and wonder why everything's getting more expensive. You have to have common sense regulations, and you have to have common sense moves, like, okay, we'll directly subsidize a certain amount of people in order to keep them out of the pool. That kind of works for everybody. It's like a win-win, and people have been saying it for 20 years. That we're finally doing it. Let's just say I'm not disappointed, I'm not going to grab a placard that, if I was a woman, like grab this pussy, or any of that crazy stuff, because I disagree with someone finally implementing some common sense reforms. Because my ideology wants more of a socialist system. Well, here's the thing. Even if half the country wants a socialist system, if the other half doesn't, as much as I may want single payer, I think it would be easier and simpler and solve a lot of problems. There's a lot to say for it. For some reason, half the country disagrees. And we can't just turn them into demons. That's a tactic that's been used on the left a lot, and it's really unfair. The right, like I mentioned before, is conflated, where everybody on the right believes XYZ when that's just not true. I remember in college, I had a lot of friends, and I hung out in the Catholic club, and it tended to be very conservative, or compared to New York City, it was very conservative, right? But there weren't these kind of Republicans in there that didn't want people to have health care, or, wanted to get rid of Medicaid and Medicare and any kind of social safety net. Quite the opposite. In fact, a lot of them were very pro-safety net. They just had something against abortions, right? They had, transgender bathroom issues or whatever of the day. So it's, we don't need to lump all these people together, just like they don't need to lump all the left together and call them all SJWs. What's good for the goose is good for the gander. We shouldn't sit there and allow ourselves to conflate a whole group and then say, don't conflate us, don't conflate us. You almost don't have a right to complain if you're one of the parties conflating that somebody else conflates you, right? So most of the country wants to, in some way, take care of people who don't have health insurance. Like I said, different paths to the summit, different trails, same summit. We just need to compromise as far as, get together in a room and figure out how to do that. I'm a little disappointed. I know that President Trump is kind of, hey, let's meet with a lot of people. Let's meet about this healthcare thing. I think he's invited Bernie a couple of times. But all I hear from the left is, everything wrong, everything bad, fire bad, And it's, that's not my left. I don't know who those people are. We're looking to just take care of people. Like I said, same summit. So it really boils down on these kind of off the spectrum right and off the spectrum left. How do we best ignore them and get going with the business of our country? One, stop conflating. Two, listen to voices across the spectrum that are trying to make sense, trying to be a voice of reason. 3, try to be a voice of reason yourself. Look into things a little bit. If something's going to work out to um, take care of people, and that's what you're trying to do, and then maybe it's not the method you want to use, you're really going to fight it? You're going to try to, I don't know, take out people at the ankles, make sure that they can't win the political game? People's health is at stake. It's not worth it to do that to people. And I would hope that people on all sides are looking at this as a game about the summit and what we get to and how we take care of people and the level of care people get, so it's adequate so they can get back to work and they can get back to living their lives, right? So I guess those are some of the things we could do, is just not be quiet, not just let everything kind of flow off our back. And when there is something that's getting to the same place that you want it to go, maybe support it a little. At least don't detract from it. At least at this time, we can actually read the entire American Healthcare Bill, Healthcare Act, because it's only 66 pages, right? Nobody knew what they passed with Obamacare. Most people writing it had no idea what the hell was going on. It's 66 pages. Read it. And realize this: if you have the Republicans that, that little wing of the Republican Party that represents the uber healthy that don't want to pay for a safety net because they know they'll never use it, if they're against Trump's plans, maybe we have the same enemy. Just a thought. Anyway, I look forward to your interactions on this very important subject. Hopefully my Voice of Reason show will be a little bit more to react to, as far as, well, here's the skinny, here's the facts, here's what we do going forward. I'm also going to use whatever website I can to bring up like fact sheets and, like official statistics, etc. So that anytime I have a recording, I'm hoping to have like a double pane where, you could click on the recording, but as that's happening, you'll have like a whole bunch of facts on the side with all the links to where you can get the actual research, or the, which website it's from, what government agency, etc. So I got, fancy plans and fancy pants to match. And I hope it makes things more clear. I hope it gets people to a point where they could see things a little bit more objectively. I know it doesn't sound like much, but that's a big, giant task in and of itself. So I look forward to your interactions, and I'll see you next time.